Okay, the topic of discussion that we are going to cover right now is we are going to talk about anterior triangle of neck. So before, what we did, we talked about triangles of neck overall, anterior and posterior in brief. Right now we are concerned about anterior triangle of neck only, right? Okay, now before getting into it, I would like to talk about in a nutshell about a little bit in brief about anterior and posterior triangles of neck. So okay, there was one muscle in the between, that was sternocleidomastoid muscle. Why it was named so? It was named so because it has originated from sternum, it has originated from clavicle, it is all the way it is inserting into mastoid process. So its name was sternocleido, right, clavicle and mastoid, right? Okay, what this muscle was doing, it was dividing our neck of triangles into two parts. What are the two parts? The anterior triangle of neck and this yellow one, the posterior triangle of neck. We talked about what? This posterior triangle of neck earlierly, right? Now talking about anterior triangle of neck, that means we are going to talk about this much region. Okay, talking about anterior triangles of neck, what we have the medial boundary. Okay, let's talk about the boundaries in nutshell. In front, what we have in front, what is this? This is the anterior midline of neck. What is this? This is the anterior midline of neck. Okay, what about behind? What we have behind? We have anterior border of sternocleidomastoid muscle, right? Okay, in front we have anterior midline of neck. In behind we have what we have? We have sternocleidomastoid muscle and its anterior border of sternocleidomastoid muscle. Okay, what we have in base? Okay, what is the base? This is the base. Now what is this? This is our lower border of body of mandible. What is this? This is our mandible, right? Mandible. This is the body of mandible, and of mandible we are talking about the lower border of body of mandible. So this is making our base. And what about the apex? The apex is made by, what is this? This is suprasternal notch of manubrium sterni, right? What is this? This is manubrium, right? Sternum, the region of sternum. And what is this? This is what? Making apex, which is directed downward. So we talked about what? We talked about front, we have what? Anterior midline of neck. At the behind we have anterior border of sternocleidomastoid. At the base, we what is forming the base? The base is formed by lower border of body of mandible, and the apex, that is that is directed downward, is formed by suprasternal notch of manubrium sterni. So this was all about what? The boundaries of anterior triangles of neck. So these anterior triangle of neck, these are divided into what? These are divided into four types. What are the four types? A, B, C and D. Now these four types are divided. How they are divided? They are divided because of two special muscle. Now what are these two special muscle? The special muscle are our digastric muscle, right, and another what? Omohyoid muscle. Now the common thing about these two things is that they both are what? They both are having two bellies. That means these are what? They are having two bellies, such as this digastric muscle, it is having what? Anterior belly of digastric muscle, and another the thing that it is having is it is having posterior belly of digastric muscle. Similarly, omohyoid, what it is having? It is having superior belly of omohyoid and another inferior belly of omohyoid. That's all. Okay, these four muscles, or let's say the branches of these two muscles, they are dividing our this anterior triangle of neck into how many parts? Into four parts. Okay, now as we have already mentioned that the common thing between them is what? They are having two bellies, right? Another common thing between this digastric and omohyoid muscle is that they are what? The common point of their insertion is our what? This hyoid bone. What is this? This is hyoid bone. Okay, now this hyoid bone, what? The digastric muscle, as you can see, what is this? This is anterior belly of digastric muscle. This is posterior belly of digastric muscle, right? We have what? We have superior belly of omohyoid, right? Similarly, inferior belly of omohyoid, right? Okay, what we have here? We have sternocleidomastoid muscle. Okay, these digastric and this omohyoid, where they are attached? They are attached here. What is this? This is hyoid bone, right? Okay, what is this? This is hyoid bone. Okay, now these muscle, anterior belly digastric, posterior belly digastric, what is this forming? This is forming digastric triangle. What is it forming? It is forming digastric triangle, or another name for digastric triangle is, it is also called what? Submandibular triangle. Why submandibular triangle? Because it is present below the mandible. below the mandible. So it has got two names. One is digastric triangle because it is bounded by two belly of digastric muscles, and another thing is that it is found below the mandible, so it is also called submandibular triangle. Okay, another triangle that we are going to talk about is this is the triangle. Now what is this triangle? This triangle is our carotid triangle. Now why its name is carotid triangle? Its name is carotid triangle because here there will be bifurcation of what? Bifurcation of our common carotid artery. That's why, right? Bifurcation of common carotid artery into internal carotid artery and external carotid artery. Internal carotid artery, it will go with being parallel with what? Internal jugular vein. We'll talk about that thing in detail. So for now, what we are saying, the triangle which is bounded by what? What is this? Posterior belly of digastric muscle. What is this? This is superior belly of omohyoid muscle. Now what is this? This is anterior boundary of sternocleidomastoid muscle. So this triangle, what is this triangle? This triangle is our what? Carotid triangle. Why? Because bifurcation of carotid, common carotid artery is taking place right here. That's why. Okay, now let's move toward another triangle. We talked about two triangle, right? This A triangle and B triangle. This A is carotid, B is what? What is the V triangle? Digastric triangle. Now let's see what is this? This triangle. What is this? This triangle is called submental triangle. Now why it is called submental triangle? Because it is what? It is coming from what? This mental protuberance of mandible. And one important fact about this submental triangle is that this triangle is just single. What is this? This is single. All the triangle, carotid, digastric, another triangle that we are going to talk, all these triangle are in pair, but only this submental triangle is what? It is single. It is not in pair. It is present in midline of body. Okay, now another triangle. Yes, we are talking about what is this? This triangle, the triangle D. What is this triangle? This triangle is our muscular triangle. Why it is called muscular triangle? Because here what is going on is that here this is the midline, right? Midline, and in this region we will find strap muscles. These strap muscles, they are so abundant in this region. They are covering what? Thyroid gland present in this region. So because since there is abundant amount of strap muscle in this region, it is called what? The muscular triangle. Okay, now what we are going to do, we are going to study in detail about carotid triangle, its roof, floor, its content, and then what we will see its content in the diagram of atlas. And then what we will do, we will go into digastric or submandibular triangle, and here we will learn about what? We will learn about the muscles, relation of muscles present within it. And what we will do, yes, this is also all about the relations of muscles present within it. And then we will move to the diagram of atlas, and there we will try to correlate whatever we have studied. Okay, now without delay, let's begin with carotid triangle. Yes, what we are talking about this region. Recall the fact why it is called carotid triangle. It is called carotid triangle because the bifurcation of common carotid artery take place here. Okay, talking about carotid triangle, let's begin from its boundaries. Okay, let's say that these carotid triangle, we are just drawing it right here. Okay, now let's see about boundaries. Initially, let's talk about boundaries. If you remember, what is this? What is this? This is our posterior belly of digastric muscle. If you remember, here you can see posterior belly of digastric muscle. Okay, this is our posterior belly of digastric muscle. Similarly, what is this? What was below? We have what? We had superior belly of omohyoid muscle, right? And at the back, if you recall, at the back we had what? Anterior border of sternocleidomastoid muscle. So these are what? These are okay in front. Okay, in front and above. Let's say it is above. In front and above, what we have? We have what? We have posterior belly of digastric muscle. And in front, this is also our front, and in front, but this is below, right? Below, front and below, we have superior belly of omohyoid, right? Superior belly of omohyoid. Behind, what we have? Behind we have what? Anterior border of sternocleidomastoid muscle, right? And okay, this is about what? This is about boundaries. And about floor, we'll come into floor after doing our roof. Now let's move into roof now. Okay, now what are forming roof of our carotid triangle? Okay, if you recall what we have discussed in earlier video about the triangle, posterior triangle or triangle of neck. In previous video we're talking about posterior triangle of neck. We talked that these three, skin, superficial fascia and platysma, right, these are the common, right, common roof of all the triangles present in neck region. Skin, superficial fascia and platysma, right, these are common in every triangle of neck. And here additionally what we are going to study, we are going to study that these platysma muscle, anterior big muscle of neck region, that is supplied by what, that is supplied by our what, cervical branch of seventh nerve, cervical branch of seventh nerve. Similarly, another thing that is contributing in roof is transverse cervical neck nerve of neck. Yes, we have listened this transverse cervical nerve. Where we listened it? We listened it where? In posterior triangle. If you remember posterior triangle, there was one point called nerve point, and from this nerve point there was what? There was coming off, or from this point there were 4 nerves that were coming out, and out of their 4 nerves, these nerve that was going anterior or transversely, that this was what, this was our transverse cervical nerve of neck. So that we can say that this transverse cervical nerve of neck, this is what, this is what common between posterior triangle, right, posterior triangle and anterior triangle, that's all. Now moving toward floor. Talking about floor, what you will see right here is, okay, talking about floor, I would like to again mention what is this. This is hyoid bone, right, and this hyoid bone was the bone where our digastric muscle and omohyoid muscle, they were attaching. This hyoid bone, right, from this hyoid bone there is one muscle, right, okay, there is one muscle, that is our hypoglosus muscle, hypoglosus muscle. The important thing about this hypoglosus, hyo and glossus, hyo means what, hyoid bone, and glossus, it denotes tongue. So this muscle, hypoglosus muscle, it is coming from hyoid bone, from this bone, and it is going and attaching to what, our tongue. So the one most important constituent of floor of carotid triangle is our hypoglosus. Similarly, another thing that you will see right here is, you will see thyroid cartilage, right, thyroid gland is present in this region and thyroid cartilage is present right here. And this thyroid cartilage, and between this thyroid cartilage and our this hypoglosus muscle, what we have is, we have muscle, right, and membrane communicating these two things, right. Now what are these? These are thyro from this thyroid cartilage, right, and we have hyoid, right, hypoglosus from hypoglosus, okay, or we can say hyoid denoting this hyoid bone. Okay, between this thyroid cartilage and hyoid bone, right, we have what, we have thyrohyoid membrane and muscle, right, you can see membrane is present right here, denoted into light green color, and we have muscle. Now this thyrohyoid membrane and muscle, these are also important constituent of what, these are important constituent of our floor of carotid triangle. So floor, what are the constituent of floor? The floor, it is made by what, hypoglosus, the muscle that is coming from a hyoid bone, and it is going all the way and attaching to what, attaching to tongue. And another is, we have thyrohyoid membrane and muscle. Now this thyrohyoid membrane and muscle, where are they attached? They are attached between hyoid bone and thyroid cartilage. And another important constituent is middle constrictor and inferior constrictor. Now what is this middle constrictor? This middle constrictor, it originates from where? As you can see, hyoid bone, it is coming all the way from what, hyoid bone, and right, it will, what it will do is, it will surround what, it will surround pharynx, it will surround pharynx, and it will help in contraction of pharynx. So middle constrictor, it is one content of floor, and below middle constrictor, what we will find is, we will find inferior constrictor. Now what is this inferior constrictor? It is divided into two parts, thyropharyngeal and cricopharyngeal. No need to know a lot about that thing right here. Okay, now what are the constituent of floor? The constituent floor are hypoglosus, thyrohyoid membrane and muscle, middle constrictor and inferior constrictor, that's all. Now moving into the important point, and that is the content of what, our this carotid triangle. Okay, recall the fact why it is called carotid triangle. It is called carotid triangle because here what we will find, we will find the bifurcation of common carotid artery into what? Internal carotid artery and external carotid artery. That's why. Okay, yes, we came to know the two content. What are the two contents? Let's not say two, let's say three. Common carotid, internal carotid and external carotid. Yes, we need to know about important point right here, and that is we need to know about carotid sheath. Now what is this carotid sheath? It is what? Okay, it is enclosing our specific content. Okay, now let's talk what are the things that will be found inside what? Carotid sheath. What is this? This is our carotid sheath. Yes, we already said that one is what? One is common carotid artery, right? Common carotid artery will bifurcate into internal and external carotid artery. Here if you will see this internal carotid artery, right, internal carotid artery, it is present within what? Within our carotid sheath, but this external carotid artery, it is not situated within our carotid sheath, as you can see. So we can say that external carotid artery is a content of what? Our carotid triangle, but it is not the content of our carotid sheath. That's important point. Okay, now as you can see, and okay, now this internal carotid artery, which is the continuation of our common carotid artery, this will run in parallel with our what? Internal jugular vein. As you can see, internal jugular vein. This internal jugular vein and our internal jugular vein and internal carotid artery, between these two structures, what we'll find is we'll find one important nerve, and the name of our nerve is vagus nerve, right? 10th cranial nerve, that is vagus nerve. This is sandwiched between what? Sandwiched between our internal carotid artery and internal jugular vein. And okay, now another thing that I'd like to mention right here is there is also what? Our spinal accessory nerve. This spinal accessory nerve, as you can see, if you remember, spinal accessory nerve is the content of our posterior triangle. How it is going into posterior triangle? It is coming all the way like this into carotid sheath, and it will go below what? Our this sternocleidomastoid muscle, and it will reach the posterior triangle. So spinal accessory nerve is also the content of our carotid triangle. Now similarly, moving further, what we have is we have we have what? We have 12th cranial nerve, that is hypoglosus nerve. What is this? This is hypoglosus nerve. It will supply what? It will supply tongue region. So if you'll see clearly, we'll find what? 10th, we'll find 11th cranial nerve, and we'll find 12th cranial nerve. These all 10th, 11th and 12th, these are the content of what? Content of our carotid triangle. So let's discuss again what we have. We have what? Common carotid artery, we have its continuation, internal carotid artery, external carotid artery, and if you'll go in detail, we have several branches of external carotid artery also. What we have? We have what? We have the below the present lowest level, that is superior thyroid artery. Above it we have got what? Lingual artery. Above it we have got facial artery. Above that facial artery we have got occipital artery, and above occipital artery we have got ascending pharyngeal artery. And it is not it is not right to show ascending pharyngeal artery right here, because it is not seen right here. It is present in medial compartment, right? Medially, it is present medially, so we can't see what accessory pharyngeal artery right here. So okay, we talked about common carotid artery, we talked about external carotid artery, its branches, several branches. We talked about internal carotid artery, and parallel to it we are having what? Internal jugular vein. Between them we had what? 10th cranial nerve, that is vagus, right? And while talking about nerve, we talked about spinal accessory nerve, we talked about hypoglosus nerve. So this was what? This was about the content of what? Carotid triangle. So now let's see in this region. What is this muscle? This muscle is sternocleidomastoid muscle, right? Okay, and backward to it, but what was this? This was our posterior triangle. And here front, what we have? We have what? Anterior triangle, right? We have anterior triangle. Now in this anterior triangle, we are talking about what? We are talking about this. What is this? This is our carotid triangle. Now in this carotid triangle, what we can see? We can see what is this? Okay. Here, if you'll see clearly, what you will see is, what was this? This was our common carotid artery. And if you'll see clearly, what is this? This is the bifurcation, right? Bifurcation that is present in what? And carotid triangle. and here what is this? This is our internal carotid artery that is going parallel with this what internal jugular vein, right? And this, what is this? This is external carotid artery, and these are, what is it? It is having different branches, as you can see. What are the branches? Superior thyroid artery, lingual artery, facial artery, right? Other branches are also there, that is not seen right here. And talking about what? Nerve, right? What is this? This was 10th cranial nerve that was present, what? That was present between, what is this? That is internal jugular vein. And what was this? This was, sorry, this is internal carotid artery. So sandwich between internal carotid artery and jugular vein, what is this? This is our 10th cranial nerve. 11th cranial nerve, it is spinal accessory nerve that will that will go deep to sternocleidomastoid muscle, and that will reach where? This will reach in this posterior triangle, right? Posterior triangle. Okay. And what is this? This is hypoglosus nerve that is supplying tongue, right? Okay. These are the things that we can see, where we can see in diagram of atlas. Now moving further, what we have is, we have another triangle, and that is digastric or submandibular triangle. And why it is called digastric or submandibular? Where we are saying, where we are actually looking, we are actually looking on this region, and this region. What was this? This was digastric triangle, or what? Submandibular triangle. Why submandibular? Because this is mandible, right? Okay. Now here, okay. Now let's talk about what? Let's talk about boundaries. What is this? This is our mandible. We know above we have lower border of body of mandible. Okay, and below, what we have below, right? Okay, let's talk below and behind. Now talking about behind, right? Behind, what we have is, we have this. What is this? What is this? This is posterior belly of digastric, if you remember, posterior belly of digastric. And front, what we had? We have anterior belly of digastric, right? Okay, front we have anterior belly of digastric, behind we have posterior belly of digastric. Along with posterior belly of digastric, behind we have also stylohyoid, right? Which muscle? Stylohyoid muscle. Okay, we talked about what? We talked about boundary. Okay, mandible, posterior belly of digastric, anterior belly of digastric. Along with posterior belly of digastric, we have stylohyoid also, right? That's all. Now talking about the what? Talking about floor, what are the content in its floor? Talking about floor, as you can see, there are two muscles. Okay, the superficial one is our myohyoid, right? Myohyoid. It is coming from, why its name is myohyoid? Myohyoid. It is coming from what? Myohyoid line of mandible. Myohyoid line of mandible. Above here somewhere there is myohyoid line of mandible. It is coming all the way from there, so its name is myohyoid. And another muscle that is deep to this myohyoid is our hypoglosus. This muscle is so important. Why it is so important? Because here there is our submandibular gland. What is present here? Submandibular gland. Mandibular gland is present here, and its duct are also present right there. So these, and another important content of floor of our digastric is, here there is presence of what? Middle constrictor also. Middle constrictor was present also in floor of what? Middle and inferior in carotid triangle, and middle constrictor is only present right here in digastric triangle. Now we need to know about what? Hypoglosus muscle in detail. Why so? Because this hypoglosus muscle is the place for our what? Submandibular gland. That's why. Talking about hypoglosus muscle, right? Okay, what is this? This is our hypoglosus muscle that we are going to talk, and I have already mentioned that hypoglosus muscle is present deep to our myohyoid, right? Deep to our myohyoid. So the structure that is present deep to this hypoglosus are also present in are present more deeper to myohyoid, but the structure that is present superficial to hypoglosus are present what? Deep to this myohyoid. Because if this is what? Hypoglosus, and here what we have got? We have got myohyoid, right? And if they something are present right here, then we can say that right here in this region, then we can say that okay, this is what? This is hypoglosus, and what is this? This is our myohyoid. So if something are present here, right here, right here, then they are present on what? Surface of this hyoid bone, but they are present deep to our this what? Myohyoid. So now let's talk about the relation of hypoglosus superficially. This is what? This is hypoglosus. I have already mentioned that this is what, this hypoglossus, it is attached to what, hyoid bone and hyoid bone and what, another to what, tongue. Now here what, the relation of hypoglossus, superficial relation of hypoglossus, there is one muscle that we need to know, right? The muscle is passing superior to hypoglossus. As you can see, this is passing superior to hypoglossus. It is passing superior to hypoglossus and it is coming all the way from styloid process of temporal bone, right? In temporal bone there is styloid process and it is coming all the way from what, styloid process. So its name is styloglossus, right? Sternocleidomastoid. Okay, another important thing that we need to know here is, here we have what, deep part of submandibular gland and its duct, and that is Wharton's duct. Okay, and talking about nerve, what we have is, it has got lingual nerve, right? As you can see, where lingual nerve is present, this is our lingual nerve, right? Lingual nerve. And another thing is that it has got another what, it has got another nerve, that is what, hypoglossous nerve, 12th cranial nerve. For example, you are a surgeon and there is a stone in Wharton's gland, duct, sorry. What if there is stone in Wharton duct and you need to what, you need to remove it out, then what you need to do is, you need to be cautious about what, lingual nerve, right? Because it is what, it is crossing our Wharton's duct, and while doing surgery right here in this Wharton's duct, there may be condition in which this nerve will get damaged. So we need to be cautious about this thing. And I have already mentioned the superficial relation of hypoglossus are deep relations of myohyoid, because myohyoid are present superficial to hypoglossus. Now talking about the deep relation of hypoglossus, as you can see, now we can see the styloid process. We have said that styloglossus muscle was coming from here. Okay, styloglossus muscle was what, superior to what, superior to our this hypoglossus. We studied in superficial relation. Now here deep relation of hypoglossus, we will find stylohyoid ligament, and stylohyoid ligament superior to stylohyoid ligament, we have got stylohyoid muscle. You can see styloid process. Here what we will see is, we will see what, we will see 9th glossopharyngeal nerve, right? And lingual artery, as you can see, lingual artery. Okay, now as we have already mentioned that superficial relation of hypoglossus are deep relation of myohyoid, so we don't need to discuss about the deep relation of myohyoid. It is enough if we discuss about superficial relation of myohyoid, right? So talking about superficial relation of myohyoid, what we will see, this is our mandible, right? And superficial, we have got what we have got, there were two muscle, one as hypoglossous myohyoid, right, and hypoglossus, right? So the muscle present which was present, okay, right here myohyoid, this is the superior. So nerve arteries that are supplying to this myohyoid muscle are in a superior relation, right? And similarly superficial part of submandibular gland, deep part was present where, in a hyoid bone. Anterior belly of digastric, we know that. So if you will see this diagram of atlas, you will find what is this, this is what, anterior belly of digastric, this is myohyoid muscle, and here you will see, if you will see the nerves, right, if you will see closely, you will find nerve to myohyoid. Similarly what we have, this is the region of what, submandibular gland, it is not seen properly. If we will remove our this myohyoid muscle, we will see this hypoglossous muscle, and there in superficially we will find what, submandibular gland. So this was what, this was the diagram of atlas. I hope you are clear about this thing now, about what, about our anterior triangle of neck, along with the triangles of the topic of triangles of neck is completed. Hope you are clear about it. Thank you and have a great day.